Good afternoon. Today is Wednesday, March 25th. This is the Health and Human Services Committee meeting. We will call it to order. Everyone is here except Riley is excused. The affidavit of posting was posted accurately. We'll rise for a moment of silent prayer and the Pledge of Allegiance. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Okay. Any changes to the minutes? Seeing none, we will consider those approved. Our first agenda item is the Washington County Mental Health and Substance Use ARPA grants. And these are the reports that Julie's going to tell us about.
Yep, that's correct. So as you may recall, we issued out $2 million in ARPA funding for grants to the community for mental health services and substance use interventions. This is the third year, 2025, of that 4-year grant cycle. And so these organizations that have been awarded these funds are in their last year of receipt of this funding in 2026. And so as in previous years, this is the end of the year reports that they provided to us. And so this is just for your information and knowledge, because at the time that we issued the RFP, there was a desire on the part of this committee to just have an update on the work that these organizations were doing. So if there's any specific questions about any of the reports, I'm happy to take them.
Yes, sure.
I had a question of two things, since I'm new to the committee. So one of the RFPs or grants was for Wisconsin Lutheran Child and Family Services that seemed to be for counseling primarily at Kettle Moraine Lutheran High School. We were using public money to support the parochial schools counseling. Is that correct?
That is accurate.
Do we do that often?
So in this particular grant, it was open to the community to reach a need in the community that they felt was unmet. And so currently, there are a lot of school-based mental health providers in the public school system. We actually have an ongoing grant that we are contract with a provider who provides that service in the community, but there was not an equivalent type of service for the parochial schools. This organization is a nonprofit. It's not itself a religious-based organization, but they have partnered with Kettle Moraine Lutheran to provide the service to those students.
And none of the other parochial schools have a high school here in the county, but they have grade schools. Did they not apply for any kind of?
They did not. They did not know.
Second question I had was about the Elevate grant. It appears they served only 7 individuals for that year, with only one person completing the RAP plan, which was part of their goals that at least 50% would complete that. Is that considered to be satisfactory?
Trick question. So what I would say is the goal of the ARPA funds was to make sure that those funds were spent in the community and not necessarily that the county was just spending those funds in ways that community organizations felt that they could provide unmet needs. We have not provided as much contractual or outcomes oversight as we would typically with an ongoing grant or ongoing taxpayer funding services, because many of these programs were either pilots or trying to see if there was a service that they could expand. And so I think that they shared in their report some of the struggles that they've had and some things that they're working on. And I would just say that for this organization, excuse me, that they would not look to receive continued funding past the ARPA grant cycle.
They still have one more year.
They do, yes. What is also not fully explained here is that not every organization spent their entire allocation, which is why you see at the end of each report there was a request if they wanted to get some carryover or expand their services for this year. And so because not every organization spent their total amount, we had money left over. And with the ARPA funds at the end of 2026, whatever we don't spend just goes back to the federal government, from my understanding. And so I will say with that organization, they did not expend their full grant. Mm-hmm.
Any other questions, comments, Supervisor Gallus?
Thank you for that observation, Cheryl. So in the broader programming, are you comfortable with the outcomes based upon the intended goals? So using these dollars, right, to help those in need that were presumably impacted by opioids in some form or fashion, either renewing those, I think you said for Elevate, this last point in question, that's going to automatically renew itself for next year, or do they have to reapply? So the question is there good criteria with you and your staff to reissue those dollars if there was success or if there was little success, however you want to look at it?
Yeah, so the ARPA funding was to mitigate the impacts of the COVID-19 pandemic and the mental health.
Yeah, sorry.
Yeah, no, that's okay. I'm just clarifying that. And so so to answer your question, they were awarded a 4-year grant. So each organization was awarded a 4-year grant to max amount $50,000 per year for 4 years. Not every organization requested the full amount, but in the end, we awarded $2 million over a 4-year period. And so those grants through ARPA are renewed each year per their original request. But at the end of 2026, when the ARPA funds are done, we will not renew any of these programs with any additional funding. If they requested funding or tried to go to another organization to state why they wanted to continue that funding, they would have to demonstrate those outcomes of what they've shown for the last 4 years.
So maybe a follow-up to thank you for that. I was leading into the next one. We still have millions of dollars of the opioid settlement based upon the successes that some of these organizations have had with ARPA money for, in some cases, impacts for drug, et cetera. Is your team making any recommendations? Should any of future opioid settlement dollars go to these organizations, or do you believe they will come to us and ask for grants?
At this time, we are not making any recommendations for opioid settlement dollars for any of these organizations for these programs that they're running. When we issued the RFP and excuse me, the grant funding, it was made very clear that this was a time-limited 4-year grant and that the county would not be continuing funding. And so they needed to have a sustainability plan if they wanted to continue these programs.
Yeah, I was just I'll just kind of finish that comment. That's what I was going to say too. If I recall, looking through the applicants for the various grants, that sustainability part was a goal that was part of everyone who submitted a grant. So they had to incorporate that into their plans and their treatment objectives and things like that, their outcomes.
Correct.
Yeah.
Supervisor Schulteis sat on the review committee with us at that time. So I appreciate that. Seems like a very long time ago. And primarily because of the, I think, high level nature of ARPA funds at that time, right? 3 years ago, it was the hot topic of things that we were all focused on, and wanting to make sure that, we were issuing the funds in an appropriate way, but then also making sure that these organizations were well aware that we would not have the capacity to continue to fund them after 2026.
Good dialogue. Any other questions or comments?
Sorry, just for clarification, while you said they were told that, do you anticipate any of them coming seeking opioid dollars?
I do not.
Okay, thank you.
Okay, anything else before we move on? All right, thank you. Thanks, Julie. And the next agenda item is I'll read the official one here. I have scratch marks. The federal and state legislation impact on food share.
Correct. So I'm going to try to walk you through this agenda item in this committee report to the best of my ability, because I know it's complex. As we've been talking at the committee level, right, about the impacts of the HR1, the big beautiful bill, and concerns we had about reducing funding and the error rate. I wanted to bring forth to this committee sort of a larger overview to try to help you get your head around what this really means and what the impact is. As we talked before, at that time, the Department of Health Services was requesting from our state legislators funding for the loss of federal funding, as well as funding to help us with our error rate. There are many iterations of trying to get that through. I think our legislators on both sides of the sides heard the concerns, and so they tried to get that through in a number of different bills. Most recently, it was passed through AB 180 and passed through the Senate about a week ago, and from what I understand, the governor signed this a few days ago. And so we did get that legislation passed through. Sort of snuck in the funding through essentially the requirements around seeking a waiver for people to not be able to purchase salty snacks and sugary drinks. So if you'll just indulge me so I can walk you through this report a little bit. The first part just sort of gives you an overview of what the federal impact is on food share of the big beautiful bill. And as you see there's some stricter work requirements, increasing the age for adults up to 64, requiring 80 hours a month of work or training, and reducing some exemptions that people maybe previously were able to get so that they didn't have to follow work requirements. The big impact for us, obviously, as we talked about, is administrative cost share, increasing the state responsibility to 75% instead of 50%. And that also then states having to pay a portion of benefits up to 15% if error rates exceed the federal threshold. There's some other items in there that impact SNAP through HR1, more specifically to the AB 180 that our legislators passed, was a policy flexibility for states to open the door for states to pursue restrictions on allowable purchases, specifically soda and candy waivers. And so in the AB 180, that is what was passed, was essentially directing the Department of Health Services to seek that waiver. So it's not enacted right now, but the Department of Health Services will seek that waiver, and that will be work that will come out through that effort. But more specifically then, what the legislators did was then add in to that requirement the request for funding to support the state in some of the impacts of the federal government. And so the funding is to cover that 25% that now the states have to cover for administrative costs. And I know we had shared from the department level, our concern was that that would be passed on to the counties. And so, so the state has funded that. And so we should be made whole, as we have been in the past, around the cost for our administrative services. But then more specifically, they also then added in funding, $16 million for additional state and county staff to support eligibility and quality control to help us to ensure that we keep our error rate below the federal rate of 6%. And so I will say this may be a question that would come. Right now, I don't know what the state's plan is when it says county staff, what that will mean. There's been some discussion around maybe the consortiums. So as you recall, we have a 5-county consortium. The consortiums have a QC person for the consortium. That's been one idea. But at this point, I don't have the information of exactly how that $16 million will be spent and on what staffing. But essentially, the staffing will help to really focus on accuracy, documentation, our own reviews, our own audits, so that we can ensure that our error rate stays below the 6% federal requirement. The Department of Health Services estimated that if we went over the 6%, it could cost the state upwards of $200 million to cover our food share error rate shared cost. And so that's why they asked for the investment from the federal or from our local legislators for $69 million. Then the last page or portion of this report goes into what the error rate really is and what does that really mean. So as a consortium, we serve 23,576 cases, and of that, 3,629 cases are Washington County. In funding year 2025, they reviewed a small sample size of 57 cases across the whole consortium. So out of those 23,000 plus, they reviewed 57 cases. 5 cases contained errors, 3 being agency error and 2 being a client error. Of the 57 and of Washington County's 3,629 cases, they reviewed 9 of our cases. And we had 1 agency error. And so you can imagine part of our frustration with this is the sample size is so small. And then our error rate, even at 1 case out of 9, was 4.3. So you can imagine if we had had 2, that would have very easily pushed us over the 6% threshold.
Supervisor Busser.
Sure.
So those numbers aren't adding up. So with 9 cases, that sounds like an 11% error rate if we had 1 error. But you're saying 4%. Is there more that goes into that than just the number of cases?
Because the error rate is of the total consortium, so of the 57.
Okay.
Mm-hmm.
So you're looking at of the total consortium.
Correct.
So, and
So if you go to the last page of that, there's a chart there, and you can see the counties that are in our consortium and the review of cases that of each of those counties. You can see, for example, Waukesha County had 20 cases reviewed, and they had 4 errors. And they themselves had a 20% error rate, but between the entire consortium, then it was a 7.7 of Waukesha's error rate and then our error rate. And so what I think is important to know about this is if you look at the error that Washington County had in last year's funding cycle, the error related to that particular household, their allotted dollars were $2,083 in food share, and the error related to us giving them $90 more than they should have received. Okay, and so, but what's important to know is that when the federal government would say to Wisconsin, you're over the 6% error rate, they're not looking to recoup just on the amount of money that we either gave too much of or too little of. They're looking at our entire food share allotment. So as an example, the consortium last year in all 5 counties gave out about $81 million in food share. Washington County gave out about $12.7 million in food share in the last funding cycle. If we had hit the 6% error rate, we would be required as a state of Wisconsin to cover 5% of our $12 million, which would be about $600,000. So if, let's say, we had pushed so right now our consortium is over the 6%. And so even though we're still at 4%, if we had been pushed to 6%, would have been penalized at the cost of $600,000 instead of, let's say, if you doubled this error and made it $180 or a couple $100 of the error that we made. And so you can see why this, the way that this has been set up has been very concerning. Well, obviously we want to make sure that we're not giving people too many benefits and we're giving them enough benefits that they should be receiving. It is a very complex system and determination process. And so sometimes errors happen. As you can see, the error that we made was around somebody's child support and how you allocate that child support. And we sought guidance from the state on how to calculate that child support. And then when the federal government came in and audited, it was determined that that was still inaccurate. So I would say, from my perspective, our staff did their due diligence to make sure they were allocating that child support correctly and asked for guidance on that. And then we're still given inaccurate information. And so I say all that to say, obviously, we think that we're in a good place now that the state has allocated the funding to implement the quality assurance controls to help us to keep our error rate low. But it is still, I feel like, a moving target, and it is still very concerning at the impact that this could have not only on Washington County, but, the state of Wisconsin overall. So I will stop there. I know this is a lot of information, and just see what additional questions you might have.
The client errors don't count against you, just the agency errors.
No, the client errors count against us as well. And one of the examples that the state was giving in their education to legislators, and even in talking with directors and helping us to be able to articulate this, is an example could be and has been one that was found in an audit is a mother of one child, so a household of 2 is pregnant, and so they get an allocation for a household of 2. And then she delivers her child, but does not inform us that she's delivered her child. And so she should really be getting an allocation for a household of 3, but we don't know she delivered her child until she notifies us. But if that case was pulled and she wasn't getting enough food share for a household of 3, that could have been determined to be an error.
Even if you didn't provide the extra money.
Correct. So errors are not only about we gave you too much food share, it's also about we didn't give you enough.
So questions about the consortium. Is that common for all states? Is it required federally? You mentioned that federally, when they, drilled down and looked at us as a county, one wonders, is it beneficial to be part of a consortium? I'm sure there are benefits, and there may be some negative sides to it too. I'm wondering if this is one of them.
Sure, that's a good question. So every state is different. Some states have state-run programs where the state does all the administrative work to determine people's eligibility and determine their benefits. Wisconsin is, county run. And so 20 or 30 years ago, each county did run their own economic support program. But there, you have to think then we're having to staff in a way that we're always able to answer all of our calls. And probably at that time was when people were coming more in person. So you imagine people are coming in and having to have your meetings with your worker and things like that. Now it's all done through a call center. And so several years ago, we moved to the consortium level model as a way to be more efficient in staffing and administrating the determination and eligibility. So as an example, when somebody calls the Moraine Lakes Consortium, they could get a worker from any one of those 5 counties. Now, there is work that we do on the back end that's just county specific, but from the call center standpoint, they can get anybody. So I'll give an example of last Monday when several counties closed for the weather. The Economic Support Consortium remained open, but in other counties, staff were allowed to decide if they wanted to work or they were going to take the weather day. And so that day, the call center had less staff, but because we were sharing that, we were able to still manage, all of the calls versus if a county shut down, then nobody's answering those calls.
Thank you.
Consortium makes a lot of sense. Economies of scale that you just described, it would be difficult and maybe foolhardy to go on our own. We would probably face other costs associated with that, staffing, etc. However, with AI being ever present, are there ways to improve the intake process, gathering information, even clients updating their information, whether it be a web-based app, mobile-based app, etc. The old days of newspaper and pencil or whatever are gone. So let's embrace that. The programs that we have today, do they need an update? And if so, could or should the county and the consortium explore what it would cost to modernize that, to reduce those error rates, or to bring about other efficiencies for everybody's stakeholders' interest?
Sure. So, currently the process is very web-based and very app-based. So people, when they start their application, they do start their application online. So it's not, when I started in this work, you used to have to come in and fill out that paper application. So that is happening already. As far as AI, I know that was explored with the state legislators and with DHS. One of the issues in using AI, even around maybe at the end, is around determination. Is right now the way that the federal requirements are is you need a human being to do that review and sort of say like this is correct and submit it that way. The federal government could change that. There's some belief that obviously they're pushing AI technologies as well. And so that could change, but that has to be driven from the federal government. In regards to improving our systems, either with, even more better improvements from technology or AI, the system is a state system. And so a county or a consortium couldn't drive that without the state. And if the state was going to do that, they would have to commit to fully investing in making it correct. And so, and not to speak ill of the state, but I work in a lot of state systems and, they're always really great up front, but they don't maintain them over time. We're working right now in a 30-year-old child welfare system that hasn't been upgraded in the way that it needs to be. And so, that is a huge commitment to be able to get from our legislators and essentially right to fund that and commit to keeping it upgraded. But I will say I know that those conversations are happening. It's just where we're at with it, it's hard to say.
Yeah, I'm not surprised just look at our IRS and how antiquated that system is. So that said, if we're trying to improve that 7.6 consortium rate down to 6%, what can or are we considering doing? Is it training of staff? Is it other mini audits or whatever the case may be? And we have to probably know what the top 5 causes for error rates are. So is that where we spend our time? Because now you get, your return on that time and effort. If 90% of them are 5 related causes, well, let's focus on what's causing those 5 related errors on average, and then we can reduce that error rate.
Mhm. I believe that is the theory behind the request for the QC positions. There is a tool that we have where we can run our cases through this tool to help us to sort of pick those errors. But right now, it's really about the bandwidth of the current staff to be able to do that. I will say we run a handful of cases through the tool on a regular basis. I know that there are consortiums counties in our consortium that don't use it right now because of their staffing. And so I think the theory is that we utilize these QC positions to regularly put these cases through, almost like a pre-audit. We're auditing before the auditors audit. It does seem a little cumbersome, but I think that's what the answer is right now, at least from the state's perspective.
So I'm just trying to think here is while you described the limitations of the state and federal system, why couldn't we or our esteemed IT department take a look at some programming that would allow us to automate some of the random sampling that you talked about? Because even in antiquated systems or limited systems, you can run macros or other automation. So if it means talking to some folks in the software industry and automation testing to be able to assist with some script writing, et cetera, that would then take those on a regular basis, run it through that tool that you talked about versus if now is it manually done, I think is what you're saying.
Yes, I think that's a great idea.
And I bet we have a lot of community members in Washington County. I know quite a few of them were software engineers, and you know what? If given a challenge to solve something, we could create a $25,000 prize for whoever solutions this, and tap into high school, college, you name it, engineers, and I bet we could resolve it.
And to piggyback on that, because these findings aren't always at the initial entry point either. They can be, while somebody's been on benefits for a couple of years, it almost seems like on a weekly or monthly basis, we should be rerunning everybody if it was an automated process.
And that's correct. Right. So there's certain points in time when people have to update their documents, so we can determine if there's been a change, because people aren't always great about updating on their own for one reason or another. And so right, some of these point in time cases are at different points in time while they're receiving those benefits. Correct.
Just another question at the risk of sounding like we're trying to totally solve this problem for you. I appreciate the dialogue though, and the thinking outside of the box. I'm back on the consortium thing, the idea that is there ever any intra cooperation amongst the various counties? Like we got dinged because Waukesha County didn't do as well. Is there any staff sharing, someone being able to help out Waukesha County because they're in a pickle, they've got someone on maternity leave or FMLA or whatever? Just a couple ideas.
Yeah, and I do think that that's probably the spirit of the consortium, right? That, if you're down then, we're picking up some of the slack. But from what I understand, right, the issue is in the taking people off the call center to do this QC thing. And there's really not a lot of bandwidth for that. And I, at the public meeting, and not trying to call out Waukesha, I always say it's everybody's time in the sun. So our last quarter audit, a different county had a number of errors that didn't have any last year. So it's everybody gets their turn.
Sure. We are human, so yes.
Mhm.
Supervisor
I'm
Troutner.
going back with all the computer things. It seems like there would be maybe two programs that need to, in the case where the mother had a baby, and she's probably on, if she's on food share, she's probably in the health system. So are those two separate systems that would have to communicate?
Correct. So the economic support system is one system, and we do get, right, we're connected to a lot, like we get people's notification when they've gotten jobs, like we're connected to some of those systems. So sometimes if people don't report things, I mean, we do find out. And so just to be aware that when there is an error of an overpayment, there is also a process by which we take that payment back. So if somebody got $90 too much this month and then we find out about it, then they get $90 less over or maybe 45 over the next 2 months. It's just in when we don't find the error, we don't get it from our system. But particularly around a healthcare system like Epic that most hospital systems use, there is no connection there because that is then protected by HIPAA.
Yeah, it's all just really unfortunate though, because especially in a case where you have someone not getting enough funding and now they're saying we're not giving you any.
Mhm.
That seems wrong.
Yes, Supervisor Gallitz.
Could you go back to the waiver seeking you talked about for sugary goods or what? So help me understand what that means. So we're saying that the big beautiful bill changes to SNAP says you shall not get unless you seek a waiver, and that waiver then occurs at a state level and not at a county level?
A little bit opposite. So the federal government in the new bill or in this budget bill created a way for states to seek a waiver to not allow people to purchase certain food items that fall under sort of the sugary drinks or the snacks. So if a state wanted to just continue to allow individuals to purchase those items with their food share, they would not seek that waiver. But our state, through our legislators, is requesting DHS or directing DHS to seek that waiver. They belabored it in the legislature quite a bit. There's some, and I don't know all of it, right? They'll have to come out and what the final waiver ends up stating. But like for example, they want to disallow sodas and maybe chips, but they were allowing shakes, like milkshakes, right? So there was some sort of debate in that place, probably around like perception of nutritional value. And so essentially, the Department of Health Services will seek that waiver, and then that will go into effect so that when, and it'll probably be complicated, right? Because it's like you can this drink is not considered sugary and this drink is considered sugary. So for our community members, right, who utilize food share, might be complicated at the beginning to determine what they can purchase and what they can't purchase. But usually we start then doing community marketing around things to know, right? But it will eventually, when the waiver is secured, prohibit them from purchasing certain items that are deemed to be, I guess, quote unquote, junk food.
Thank you.
Mhm.
Any other thoughts, comments, questions?
Sorry.
He always has another
Yeah,
one,
well-
Supervisor Gallitz.
I'm not my best today, so I'm coming back to the question about the penalization part of it, right? So the consortium right now is 7.6. So when is that federal penalty expected to go into play? And then how how should or will we plan to potentially account for that, right? If we're averaging above 6 today, and if it's going to take us a while to get that down to 6 or below, are we going to look to our biennial budget to fund potential? Because I know a couple months ago, we sat here and talked about this, and it's like, well, if we have our house in order, why should we be penalized? Because the thought was, well, all of counties across 70, whatever, 2 counties get, the same hit, or will it only be those that are in quote unquote violation? And I don't know did you address that already or not? So will all of Wisconsin, be held to that? Would they do an aggregate of all the counties? And if we're above 6%, then all the counties will pay into some form of that payment or that penalty?
Yeah, okay. So this goes into effect in the next federal budget year cycle, which is October 1st of 2026. So they go October 1st through September 30th is the federal budget year. So we do have a little bit of time to get our house in order, as you say. That has not been determined, right? So I believe that it looks at the state's error rate, and so as you can imagine, there are other counties in our state that service a lot more people, right? And so then it's just ripe for the potential of a lot more errors. And so and I can get this clarification for you, but I believe that it is the state error rate overall. And then I have not heard whether the state would pass that payment onto the counties based on their own error rate, based on their consortium. At this point, the Department of Health Services has been educating the legislators that this will cost Wisconsin upwards of $200 million. But there has not been any conversation around whether they would require counties to pay that instead. I believe that would probably have to be legislated. And so we certainly, when we start to know more about what the plan is, we could advocate and do some advocacy on that end. I did bring it up. Human Services has our Wisconsin County Human Services Association, and I did bring up that question to our board that I sit on the board around how states will be, or how counties could be penalized. But at that point, everybody's focus, right, was on getting this funding passed. And so I think now the next step is seeing where we are in the next several months and then determining if Wisconsin, would be penalized, and then what the state decides to do with that.
Thank you.
Thank you.
Great discussion. Lots of good questions. Thank you, Julie. Appreciate it.
Supervisor Schultes, can I say one more thing?
Yes.
Okay. I just wanted to say thank you for your leadership and time on our committee, I should say, not just mine. We really appreciated your support and your advocacy and your, calm and, assured guidance. So I wish you the best, and I appreciate you, and thank you so much.
Oh, you're welcome. It was a total honor. I was going to say our next agenda item is the next meeting date, and it'll be to be determined because today is my last meeting. So thank you, Julie. And it's been truly an honor to serve alongside of you and with this committee over the last 4 years, 2 different terms, and just learning a lot. And your staff are wonderful. It's a big, important department. I mean, every department in Washington County is important, but there's a lot going on. We help a lot of people, and I think this committee has been really good and very inquisitive and asking lots of great questions. So thank you, and it's been an honor. And thank you, Julie.
Thanks.
All right. Having said